Non-surgical rhinoplasty, everything you need to know. What is the definition? What does it actually mean? What is the goal? What is the difference between surgical rhinoplasty? What's the lying under anatomy that's important? What are the potential downsides and risks? What techniques can be used? And what are the costs? I'm a board-certified facial, cosmetic and plastic surgeon. I specialize in just facial surgery, and so I do non-surgical treatments and surgical rhinoplasty. And I do complex revision rhinoplasties for patients, and I published in various research articles, and previously I've worked in multiple areas, including Los Angeles and New York. So in terms of non-surgical rhinoplasty, well, what is it? Well, really, it's a fancy name for filler in your nose. And filler is an artificial substance, a gel that has been made by clever pharmaceutical companies, made out of complex carbohydrate. And that gel can be put in certain areas of the face and it can soften shadows and depressions. There is no surgery, but it's limited because it can only involve adding. What is our goal? Well, our goal really is to define what's going to give the very best results. We all know a beautiful face, we all know a beautiful nose when we see one, but that's what we want to create, either non-surgically or surgically. And we have various ways of doing this. We can look at proportions of the face, we can look at relative balance and harmony, but there's also a degree of artistry with this. And we have actual measurements and angles for every single aspect of the nose, in comparison with your forehead and the nose, in comparison with the lips and the nose, the philtrum. All these angles have been measured, and we have ideal measurements for men, for women. However, the definition of perfection varies greatly, both in men, women, different ethnicities, youth. And so there's definitely a degree of personalisation. What is the perfect nose and perfect results differs greatly from person to person. Why is the nose so important? Well, the nose, it sits in the center of your face. We all know a beautiful nose when we see it. A nose lies in relative balance and harmony with the rest of your face. And it can be a symbol of youthfulness, and it can give you more definition in your face. However, sometimes if your nose is a little bit out of balance, and it might be that there's a bump on the bridge, it might be the tip is too wide, it might be the overall nose is too big. When your nose is slightly out of balance with your face, well, that kind of takes the attention away from other characteristics of your face. You may have really beautiful eyes, but if your nose slightly detracts from that because it's slightly out of proportion, it can take away the characteristics from your face, because we tend to be drawn to things that look slightly out of balance. So we talked a bit about what's our goal. Well, it's all about proportions. You know, this lady, well, she felt her nose was just too big for her face, and absolutely it was. And so I did shape the bridge, and I improved the profile of the nose and gave her a more feminine shape to the nose. But she also had a small chin, and that chin made her nose more prominent. So it was very important to look at that at the same time. I did this surgically with a chin implant, but it can be done also non-surgically with fillers. But that gave her a much more harmonious profile and a much more feminine appearance. Another patient, well, this patient has also a similar bump on the nose, and the nose looks just out of proportion, it looks too big for her face. But she also has a certain ethnicity, and it's important with any kind of procedure, whether it's non-surgical or surgical, that ethnicity is maintained if that's the patient's wish, because that gives character and personality to a person's nose and ultimately the face. So we need to define what is non-surgical and when is surgical rhinoplasty going to be more beneficial. Simplistically, with fillers, non-surgical rhinoplasty, we can only really add to your nose. We can't take anything away. So if we need to reduce or make something smaller or more defined, well, surgical rhinoplasty is definitely going to give you a better result. If it's in terms of adding, sometimes in medical jargon it's called augmentation, that can be done to some extent with fillers. But in certain cases, using graft material is going to be much more powerful because more can be added and it gives more definition to the nose. Because filler generally is quite soft and gel-like, so it doesn't give a lot of definition. And then of course there are other considerations, whether you've had previous procedures or trauma that can create scar tissue, which can add another layer of complexity. And of course, if you have breathing issues such as a deviated septum, well, at the moment, there is no non-surgical way of improving that. It's only rhinoplasty combined with septoplasty that's really going to enhance that. So what are the limitations? What can we achieve? Well, the limitations are down to multiple different factors. How large your nose is? Well, we can only make it smaller with surgery. If it's a little bit asymmetrical, we can correct that with fillers. If it's markedly crooked, well, then you're going to need rhinoplasty to correct that. If you have a wider tip, well, the only way to give true definition to the tip is to give more definition through shaping the cartilages and defining the skin, and that's really through surgical rhinoplasty. Ethnic skin or wider noses, well, often surgical procedures are going to be more beneficial, and if you have issues with breathing. So this is one example of a patient of mine where there was wide nasal tip, and so where the tip is wide, only with surgery was I able to refine the cartilage and give more feminine and definition to the nose. Adding volume to the nose, well, this can be done with fillers along the bridge of the nose. However, often if the bridge is quite low, the best way forward is to actually use graft material because that will give more definition. So this lady's nose before the surgery, it was really starting at the lower eyelid, and that makes her nose shorter. Well, after using graft material on her nose started at her top eyelid, which made the nose more elegant and more feminine. Well, what about the anatomy? What makes up the nose? Well, the top third is bone, and that bone is kind of very rigid and strong. But most of your nose, 2/3 of your nose, is actually cartilage, and that's what makes it more soft and pliable. And if your nose is a little bit crooked, well, you can push your nose and you can make it straighter. The challenge is that memory of the cartilage takes it back to its original shape. When looking at using non-surgical treatments, we need to think, well, what are the changes that we're looking to modify with fillers, and where can we apply that to the underlying anatomy? The septum really lies within your nose, so it's very difficult to see the septum without looking inside the nostril with light, and often doctors will use like a camera called an endoscope to look inside the nose and look at the septum and look at the airway, primarily to look at breathing. What are the other characteristics? Well, you have facial muscles, and those muscles, well, they don't have like a strong purpose, but they can certainly open the airway, they can flare the airway, and certainly with aging, you can get little horizontal lines on the bridge of your nose, and those are often called bunny lines, and that's where Botox can sometimes soften those lines and soften those movements. Underlying this, there are blood vessels, and we have some main blood vessels like the angular artery, and these arteries supply your nose with oxygen, with nutrients. Now, in terms of how complex this vasculature is, we have this anatomical plastication model by Professor von Gunther, where he showed every single blood vessel in the human face, and we can see the complex arrangement of blood vessels around the nose and your face in general. Now, the other important consideration is skin thickness, because skin thickness in a patient with thinner skin, fillers can really smoothen out and beautify the nose by correcting very minor imperfections. In ethnic skin, which is often thicker, or some patients who have thicker skin just naturally, well, it's much harder to do that because the skin has a different kind of feel to it. What about the risks of non-surgical rhinoplasty? Well, there have been some really unfortunate cases all over the world where non-surgical treatments have led to significant damage. Now, this patient had filler injected in her nose, and we can see the damage to the skin here called skin necrosis, and this would have healed, but it ultimately would have healed with a scar. There have also been more tragic cases where injections of filler into the nose has resulted in damage to a person's vision or even blindness. Now, this is taken from a scientific paper that was published in Australia. So there are danger zones in the face. And danger zones, well, it really means being cautious in these areas, because the majority of non-surgical treatments, fillers, are very safe. However, you need to respect the underlying anatomy. Now, what can actually happen with fillers if they're injected without the due respect and consideration is that filler, if it's injected into a tiny artery with sufficient force, that can inject the filler all the way to the back of the eye, and ultimately the back of the eye, it can affect the vision. Skin necrosis, potential damage to vision. Well, anyone doing fillers in this area needs to have a plan of action if this was to happen. Now, we're talking about a very rare risk. We're talking about a risk that's less than 1%. However, any risk can actually occur, any complication can occur, and it's very important that your physician, your surgeon, your practitioner who's doing these treatments has these kind of tools available to them in order to remedy the situation, because if it's remedied very quickly, it will not cause any harm at all. And the key ingredient is hyaluronidase, and this is an enzyme, a medical product that's available by prescription that can be injected as soon as that filler is causing an issue, and it will dissolve the filler into water. However, although fillers do not require medical prescription, hyaluronidase does. And certainly in many countries in the world, including the UK, currently we have a discrepancy because many non-medically trained people, such as non-doctors, non-nurses, are able to give fillers. However, because they can't write prescriptions, they're not able to have the filler antidote. And if you need it, well, you need it urgently. You don't want to wait. There are, of course, other treatments as well, sildenafil, hyperbaric oxygen, and these are also available in my clinic, but many clinics will not have these kind of facilities. Prevention is much better than treatment, and so key with the technique is using refined techniques that will minimize the chance of these kind of issues or complications. Aspiration technique, low pressure injections, injecting tiny volumes in very specific spaces, using very small needles, ideally using cannulas where available, avoiding needles, and using tiny amounts of local anesthetic, which has adrenaline that causes constriction of the blood vessels, making these issues less likely. So let's talk about technique. So hyaluronic acid, it's a gel, it's fluid, it can be dissolved by an enzyme. There are different properties of these fillers. In the nose, I would generally use a hydrophobic filler, and that means it doesn't tend to swell or enlarge. Those kind of fillers that are hydrophilic, the opposite to that, water-loving, are best used around the lips and the cheeks where it creates a more unified volume. How long do they last? Approximately a year. And there's a debate whether needle or cannula can be used, and it really depends on the indication. Now, what is the difference between needle and a cannula? Well, a needle has a sharp cutting tip, and it can cause a little trauma to the skin, and it has the potential to affect a blood vessel. However, used with caution and in specific areas with the right technique, they are safe to use. A cannula is a little bit different because a cannula has a blunt end to it, so there's no cutting and it slides in the skin, and certainly in many patients it will reduce the risk of damage to a blood vessel. Often it's useful to use a little bit of local anesthetic or use a little bit of cooling agent to cool the area. Sometimes patients, I will use like a local anesthetic cream, and it depends on the individual and what is actually required. The bridge of the nose is an area that we can use filler because we can add a little bit of filler above a bump and we can add a little bit of filler below a bump, and that can make the bridge much smoother. And this is an example of that. There's a small bump here, adding a little bit of filler above and below, it made this area completely smooth. Now the downside of this is if you have a large bump on the bridge, it will make your nose bigger, and most people don't want a bigger nose. So if you have a more moderate bump or larger bump, well, it's difficult to do non-surgical rhinoplasty because it will just make your nose bigger. If there's a minor imperfection along the bridge or asymmetry, well, this can be very nicely treated with filler because that filler will just smoothen out the irregularity and make your nose smoother. In terms of recovery, well, you notice an immediate improvement with non-surgical rhinoplasty. A small proportion of people, less than 5%, can have a little bit of swelling or sometimes a tiny amount of bruising. But generally speaking, the recovery is immediate, and expectations are key because there are limitations that can be achieved with this. It will be helpful to avoid things that thin your blood before having this kind of treatment, such as aspirin, non-steroidal anti-inflammatories such as ibuprofen. If you've got a tiny bruise, using ice for 10 minutes afterwards will help reduce swelling and potential bruising. And there's some evidence that you reducing exercise on that day can also help. So a cannula technique, which is blunt, can be very helpful for using areas that are a little more hazardous. Tiny volumes can be introduced, and ideally we want to have symmetry, and the filler can be a little bit massaged into place. A needle technique, well, that can be helpful for some patients, particularly if you've had previous treatment or surgery because there's scar tissue, but that needs to be done more cautiously. And in terms of adding volume, less is definitely more. You never want to add too much. You want to be really conservative when filler is introduced. In terms of the technique, well, we want to go just beneath the skin, particularly in thin skin. We want it to be smooth and inject slowly, and that slowing injection means it's less likely to be flowing along a blood vessel, and we always want to be conservative. This is one patient that I treated, and she had a very kind of irregular bridge, and that was really because she had really thin skin, and with filler we were able to make it almost perfectly smooth, and you can see the light reflex afterwards is almost a straight line. And then in terms of projection, well, sometimes we want to make the nose a bit more projected and lift the tip just very slightly, and that means putting filler along this area of the nose, the very bottom of the nose, which is called the columella. It is a sensitive area, so I use cooling local anesthetic to help with that, and you only want to inject a small amount in this area. Well, we can just lift like a very slightly droopy nose, and it can improve the shape of the bridge when the tip is lifted. After rhinoplasty, well, fillers can be really helpful to reduce tiny imperfections in the skin, particularly if you have thin skin. Well, sometimes when all the swelling has gone, there can be a tiny imperfection, and that can be really well treated with fillers, avoiding further surgery. And in many patients, this will give a better, more refined results. But most people don't need this. Less than 5% of patients need this in my hands. And this is an example of that. This is a lady who came to see me because she had a complex issue following her first surgery elsewhere, and I was able to refine her nose and make it that bit better for her without doing surgery. How long do fillers last? Well, generally they will last for about 12 months, a year. Sometimes they will last much, much longer. For some patients, I will use like a permanent filler because that will give like a permanent improvement. However, I will only do that really in patients that I've done surgery for. What is the cost? Well, the costs can be determined by the location and how much regulation is in that area. Having treatment in the centre of London, Harley Street, well, there are certain costs associated with that. There is a lot of regulation in terms of healthcare practice in the UK. It's termed the CQC, and that provides a very high quality but comes at a certain cost. The experience of the surgeon, the doctor, who is performing the procedure, as we alluded to earlier, well, in certain countries you don't have to be a medical practitioner to do some of these treatments, and that may significantly reduce the cost. However, you may be putting yourself at a certain risk because if the anatomy is not well understood or the potential downsides and risks are not accounted for, if there is an issue, it could be quite difficult to find management. Complexity of your nose. Have you had previous treatments? Has there been trauma or surgery that might create scar tissue? What kind of treatment is required? Sometimes more than one treatment is required. And then in terms of what is required, the product that's used, and the cost can vary quite significantly from a few £100 to actually a few thousands of pounds. And I do hope this has added some information to you and enable you to have better treatments in terms of non-surgical rhinoplasty. Thank you for watching, and if you have any other thoughts or questions, please do not hesitate to contact me. Thank you.